Good morning, sir. Hello, good morning. Am I audible? Hello, hello, hello.
Good morning.
Hello, good morning, sir. Sir, Vijay ma'am is joining shortly. Just allow us 2 minutes.
Hello, sir. Am I audible? Hello. Sir, am I audible?
Yeah, I can hear you.
Yes, sir.
There's a lot of background noise.
Actually, for the stroke, today on the occasion of the World Stroke Day, we are organizing this expert panel discussion from MediGence side and having. So we are just organizing this event on an online event for the expert panel discussion to for our patients who are seeking the expert advice to learn about what is stroke all about, what are the implications, what are the possible complications of the stroke, what is the line of treatment. Yeah. So we are just about to commence, sir.
Sure. Thank you.
Thank you, sir.
It's all fun. You joining?
uh, Sir, am I audible now? Dr. Narayanan, am I audible?
If we were
नहीं आवाज नहीं आ रही है
joining, he will start. Can you make senior doctor?
Sir, can you hear me?
मुझे पता है.
Hello.
अरे मैम, आपने join नहीं किया? Slack से.
um, Hello.
She's joined. Should I start? Ma'am, you can
Yeah.
commence the session. Thank you.
Okay, thank you. Greetings to our dear viewers. Welcome to Health Talk with Experts by MediGence. MediGence is a digital healthcare organization with only one mission: to make healthcare accessible and affordable. Through our health talks, we aim to connect you with leading doctors across the globe for our people to take informed medical decisions. I am your host, Dr. Vijita, Clinical Director at MediGence, and today, on this World Stroke Day, we are here to know more about this deadly disease which affects millions globally. Today on our panel, we have pioneers in the field of neurology, General C.S. Narayanan, Chairman Neurosciences, Manipal Institute, and Dr. Anirudh Balasubramanian, Senior Consultant, HOD and Professor, Amrita Hospitals. I welcome you both, sir, and thank you for taking out time to join our panel discussion. Can you hear me, sir?
Thank you, ma'am. I can hear you. I'm Dr. Anand.
Okay. Um, General Narayanan is also in the group. Sir, can you hear me? Vihan, are you there? Can you just check?
Yes, ma'am, you're audible. You can commence the session. Yes.
Okay. So, sir, we all know that there is a plethora of information regarding stroke on the available on the internet for people to see and read about it. So today in this discussion, I want to touch uh, the information which are less available and which will come through your expertise in this field in the management of this deadly disease. So my first question to you would be, what is the difference you have seen in the past decade about the incidence and rise in stroke with respect to age, ethnicity, urban and rural population? So I start with you, Dr. Anand. What is your experience in the field?
Yes, ma'am. Stroke incidence is definitely rising. It's kind of a lifestyle disease.
Yeah.
It's because of, say, increased blockage of the blood in the blood pipes. That's one of the
Okay.
reasons we call a stroke develops. This is what we call a classical paralytic stroke attack or a ischemic stroke. The
Okay.
other form is the bleeds that happen, the
Yes.
hemorrhagic stroke that causes
Mm-hmm.
a bleed in the brain. So that
Okay.
can be happening because of hypertension, increased blood pressure. So both
Okay.
these cases, both ischemic and hemorrhagic stroke, are
Mm-hmm.
a resultant of lifestyle changes,
Okay.
increased cholesterol in our blood, and
Mm-hmm.
heart problems, sedentary lifestyle, stress
Yes.
induced issues,
Mm-hmm.
smoking. So, all
Yes.
these increase the risk of stroke. And we are
Okay.
seeing this more and more in the urban population in younger people. We see
Okay.
30-year-olds coming with stroke, which was never there before.
Yes,
Not only
yes.
heart attacks, but even brain attacks, like what we
Mm-hmm.
call the brain stroke as.
Yes,
It has
yes.
easily become a problem not of the elderly, it is even prevalent more in the younger population now.
Okay. General Narayanan, what is your opinion on the same? I think he's not available. Not a problem. We'll continue. So, Dr. Anand, what is the most significant lifestyle change that you have observed in the younger population that has led to the rise in the incidence of stroke?
Um, Probably odd working hours, odd eating habits, and not regarding health as a priority. So we are all
Okay.
caught the tiger by the tail. We are running behind jobs and works, and
I know.
less time to eat or give focus on what we eat, and focus on how we spend our activity, physical activity in the day. More time
Yes.
spent in the office, more time spent in front of laptops, eating more
Yes.
processed and ready-made foods, and
Yes.
drinking a lot of unhealthy drinks.
Yes. General Narayanan, can you hear me, please?
Ma'am, yeah,
I think Dr.
Doctor,
Anand.
yeah, Doctor Narayan, are you like, hello? Is there some internet connectivity issue at your end?
I think so because he's trying to join.
Yeah. All right, ma'am. Till the time you can just continue and we can proceed.
Because
Yeah.
Dr. Narayanan is not able to hear and Dr. Anand is not on the call.
Ma'am, you can talk more about rehab, and as he gets in, we can chip in.
Let's wait for 1 more minute.
Sure.
Daniel, can you ask Vihan to just connect with both of them?
Sure, ma'am. We are doing at the back end. Yeah. Ma'am, you can talk more about rehab till the time we are connecting with both of the doctors once they are in.
Sir?
Hello.
Yeah, Danny.
Ma'am, you can start with rehab and talk more about it till the time we are connecting with the doctors and checking.
Yes, we can do that, but I think we should go in a flow.
Ma'am, Dr. Anand is having internet issues, so we are trying to resolve that. Till the
Okay.
time you can commence forward, so we keep the flow as planned. Yeah?
Yeah, just a minute.
Okay. Sir, is internet okay at your end? Because we have dropped you in between, Dr. Anand.
Yeah, I'm
Sir,
back.
can you hear us?
Yes, ma'am. It's all fine.
Yeah, I can
It's
hear
all
you.
in comments now. Yeah.
So,
At the
sir,
same time, I'm trying to connect with Dr. Narayan. You can commence with Dr. Anand. Meanwhile, we are connecting with him. Yeah. Thank you.
sure, not a problem. So, sir, MediGence has worked beyond physical boundaries, and we have conducted OPD camps related to stroke uh, beyond across the landscape. So, we have seen a significant trend in people in complying with the, uh, complying with the basic needs of preventing stroke. Like if somebody has a high blood pressure, they do not take the medications because they fear that they will have side effects, related to erectile dysfunctions, etc. So, what is your say on that, and what would you advise the people?
Taking medication is very important and very essential to maintain a good style of living. And the medications which prevent blood pressure rise have to be taken regularly. The problem is people feel if they have BP, they take medicine. BP normalizes, they stop it.
Okay.
So that's not correct.
So,
And
sir,
you have to.
what do you suggest to our viewers? They, as I said, they fear some side effects. So, what do you suggest? How should they go about it and not fear about having these side effects?
Okay, so see, there are lots of medicines for blood pressure. So we don't know which patient is going to get suited for which type of body status. So if one medicine doesn't work, has side effects, they have to get back to the doctor, let the doctor know that this medicine is not suiting them, and change
Yes.
over to another, say, class of medicines, which may suit them better. It is more like a trial and error. Some
Yes.
patients will get well settled with certain medicines. So till you find your right set of medicine, it is not good to keep changing your doctor or changing your medicine or stopping it altogether. That is bad because your
So
BP will
basically,
go up.
self-medication should not be done, and they should always consult back to their doctors so that
Exactly.
informed
Exactly.
decisions can be taken and a risk is avoided.
Yeah. And if you're a patient of blood pressure, you should
Yes.
invest on a simple blood pressure apparatus at your home and keep
Okay.
checking at least periodically, if not daily, weekly, once or twice, so that
Yeah.
you know your blood pressure is under control. We
Yeah.
cannot ignore it and go ahead with our work. when the
Yes.
BP in the background is eating into our body's system.
Yes. Sir, as we started with our conversation, you had mentioned that we see a very high rise in incidence of stroke in the younger population. So, sir, and at the age of 25, 30, 35, when we are busy with our lives, it is difficult to keep a check on the blood pressures and anything related to such illness. So, I want to know what are the features or symptoms that one should take care, not at the time of attack of stroke but much before that, so that you can be aware that you have this kind of issue and you should take preventive measures to prevent stroke in future.
Yeah. So there are two things here, Ma. One is normally in the age of 20s and 30s, nobody is a patient of any illness.
Yes.
So we get into that problem because of irregular habits and
Okay.
unhealthy habits.
Yes.
So as a general individual, we should learn and be with as much healthy habits as possible. We are used to literally punishing our body with lots of work, irregular timings, because we can stretch it. We are in the middle of the youth. The body
Yes.
can take a lot of stretching and lot of uh, what to say punishment from irregular hours, irregular eating. You can go fasting for periods. You can do binge drinking. You can smoke. You can do this, do that, but nothing immediately affects. But then your
Yes.
foundation is getting affected to the level that few years down the line you suddenly realize that you have got this problem, you have got that problem. So many problems start accumulating without your knowledge. So the
Okay.
foundation should be healthy and strong. So for that, whether you are an individual with a disease or not, we should be educating our youth to live a healthy lifestyle. That's very important. I think even in schools we have to stress that, in colleges we have to stress that.
Yeah.
Either they overdo it, they go to the gym to build a body and take too much protein supplements and steroids and land in the other end of the spectrum, or we
Okay.
are on this end wherein we are only into our work, books, and going forward in our jobs, that we forget that health is very important part of it. If you're not healthy, we cannot do anything.
Absolutely,
So
sir.
fitness and health is most important. On top of this, if you have a problem, if you have been identified with a problem, then it should be more rigorous. The discipline should set in. We should
Absolutely.
accept what our body is. We can't
Yes.
change it. We got our genes. We have a genetic susceptibility. If your father, mother, grandfather, grandmother, they have had a hypertension or diabetes or heart disease, we do know that these are genetic, and you are also in line to get these problems at some point in life. So
Absolutely.
you can avoid it to a great extent by at least changing the environmental factors. So the
Yeah.
genetic factors is one, the environmental factors is the other. So the
Yes.
environmental factors is under our control, and genetic factors we have a clue from our relatives and parents what disease they have gone through and what they have suffered. So it's very easy to reflect and not think that we should not think, okay, they got it, I won't get it. We are
Absolutely.
going to, we are in the same gene pool. So then
So,
we have to be more disciplined. We can still enjoy life, but in a disciplined manner.
so, sir, do you suggest that, as you said, that the we should consider if somebody in our family has any kind of heart issue or blood pressure or diabetes, so the youngster should consider periodic health checkups, even if they are
100%.
even if they are in the 20s or 30s. I mean, 6 months they should have a complete body
Yeah,
checkup.
it's a good idea to have, especially when you crossed your prime adolescent period and you're entering your youth. Maybe not in the 20s, but definitely in the 30s. Anybody above the age of 35, 40, when we as doctors meet some individual beyond 35, 40, we tell them very clearly, please register yourself at least for an annual health checkup. And if they are coming to us for any reason, maybe a small cut somewhere or a small swelling here or there, we are going to operate, we
Yeah.
insist on them undergoing a whole body proper checkup.
Checkup.
So that
Yeah.
this is a chance that they have come to a doctor to meet. It's good to get certain basic things checked. Then you
Yeah.
know where to put your hands on and where to concentrate or focus on. If not periodic, yearly. If you're above 50, maybe you have to do yearly checkup. If you're just above 35, 40, you can do alternate year checkup. Now, all
Right.
insurance allow medical health checkup every year or every alternate year. So it is good to do
Absolutely.
that too.
Yeah. So, sir, one interesting question I have. So, we see a lot of people going to the gym, as you said, building up bodies, taking protein supplements, everything. So, uh, do you feel that just going to the gym and not maintaining I mean, still they consume alcohol and they do smoke. So, are they at a lower risk of getting a stroke? I mean, people do think that they when they go to the gym that they
Definitely
won't
not.
get it.
Yeah, so going to the gym just to get a physique which looks good or to show off does not restrict your susceptibility to a disease. So
Absolutely.
healthy lifestyle is a package. It's not just muscle building. Gym
Yeah.
is just muscle building, physical fitness. So you're just building your stamina, your strength. But
Yeah.
then that is just one part of the whole story. It also depends on how much you what you eat, how you eat, what are your other habits. So all your habits have to be within normal range. There is no normal range for say smoking. Drinking, you
Okay.
may say one or two drinks allowed, but then drinking is also harmful. So
I know.
it's better to keep away from these as much as possible if you can, and especially if you're susceptible to it. So binge drinking, no. But unfortunately, most youth involve in binge drinking, and then they think if they go to the gym next day and spend out more calories, that will be fine. That doesn't work that way.
Absolutely true. Yeah, sir. So, sir, as we discussed, sir, stress has become a part of our lifestyle. I mean, even 5 years before, 5 years ago, we would not be hearing this word too much. But today, even the students going to school talk about stress. Now, lifestyle has changed a lot, and what do you suggest, I mean, with this lifestyle, how can people prevent, as you said, obviously a good eating habits, this and that is important, but what message do you need do would you give to the younger generation, especially who have just going to the school or going to the college, starting with their careers, with the stress and with the pressure they are going through, how can they maintain a good lifestyle? I mean, what is the one thing that they should do to get a to avoid this kind of illness?
Yeah, it's first and foremost is I think awareness. So once you're aware, then
Because stress
automatically
management
things
is,
fall in place.
stress management is something that people need to do at this point of time, even the students.
Exactly. Exactly. See, stress is part of life.
Yeah.
Yeah. Without stress, we cannot live. Stress makes us grow, makes us mature. But then we should know how to handle stress. Some people internalize it. Some people show the stress. But what is more important is how do you mentally uh, act to stress in such a way that your body doesn't get affected, your health doesn't get affected. So again, you need to, if you don't know ways and means of figuring out how to handle your stress, you should seek out for help. You
Yeah.
have good role models in your company with your peers, you can follow them. Otherwise, you can start practicing simple things like meditation, yoga, or you can take professional help if stress is too much. Nowadays, there are enough psychologists available. You don't have to become a psychiatry patient. You can
Yeah.
at least talk it out. Now, even
Yeah.
I'm told some AI softwares are there which can listen to you, which acts as counseling agents, which can. So it's good to develop a good friend circle. I think as youth, most important I feel is your peer pressure and your peer circle whom you associate with. That's very important. You
Yeah.
have good stress busters because being in the good friend circle itself is a great stress buster. Following good habits. If these people follow good habits and you are into it together as a healthy lifestyle situation, that is good. That makes life much better. Individually, it's very difficult to handle stress. And in family, probably in this age group we are talking about, may not be into family as yet, and they may not be the ones who may share their issues with their parents or their brothers or sisters. So the friend circle you pick is very, very important. If you have a friend circle who is into not such a healthy lifestyle, then you're going to be dragged along that, thinking those are your stress busters. And that's where you're going to
Yeah,
go wrong.
absolutely, sir. Sir,
Vijita, can you hear me and see me now?
I can hear you very well, sir. Welcome, General Narayanan. I
Yeah,
think
yeah,
you
we're struggling to connect. I'm sorry for the delay.
not a problem, sir. We completely understand. So, sir, we have been talking to Dr. Anand, and we have been discussing, the current rise in incidence of stroke, especially among the younger population. And Dr. Anand was giving us insights on for the youth to completely manage their lifestyles, how to develop good habits, and what are the predisposing factors leading to stroke in today's lifestyle. So, coming to my next question, sir. Sir, I have seen, a lot of patients, like in a daily lifestyle, daily routine, they have constant headaches. So, should that be a concern?
Yeah, headaches are very common. In fact, if you given a population, I think about 10 to 15% of the population will have headaches, and
Yeah.
many people write it off as just any other headache and don't pay too much attention to it. They just pop in a pill whenever they get
Yes.
a headache. But even simple headaches like migraine and all that require specific medication for them to improve their quality of life, for them to have less headaches, less severe headaches. And of course, in some subset of the population, the headache could be even more sinister. So,
Okay.
no person should ever write off any headache as just any other headache. They should report to a doctor.
Okay.
If they are fortunate, the vast majority of them will have headaches like migraine, which can also be treated effectively. And in a minority of them, there could be more sinister causes like a brain tumor or a stroke or a clot in the brain,
Yeah.
what we call a subdural hematoma, which can happen in the elderly, even if it's minor knocks on the head. For example, a 70-year-old person comes with a headache, then you should definitely suspect other causes and investigate accordingly. So there are some red flags for these headaches, and I think I'd like to talk a little about them. One
Sure,
of
sir.
them is headaches which happen, which has just suddenly cropped up in the recent past. A person
Yeah.
who's been having headaches for several years is less likely to have a sinister type of a headache.
Oh,
Then
okay.
headache, which is of crescendo severity, like it goes and become more and more severe over the next over the course of a few days or a few weeks. That should be paid attention to. Headache, which happens in the elderly, is should be taken note of. Headaches when you visit a doctor and the doctor finds some abnormality in the neurological examination, that is also a concern. So that is the sign that you must investigate further. Headaches
Okay.
in which happen in persons who've got other comorbidities, like a headache which happens in a person who's got hypertension, who's got diabetes, or he's
Yeah.
immunocompromised.
Yeah.
In all these situations, further investigations are required. So my uh, basic brief message is: don't
Yeah.
take any headache lightly.
Yeah.
It may be a simple headache like migraine, which also can be treated effectively
Yeah.
rather than taking in normal medications like painkillers. There are migraine specific medication which will make the quality of life much better. And
Yeah.
more importantly, we must not miss the red flags of more sinister headaches.
Yes. So you always suggest that if the headache is there for a prolonged period of time, they should get back to their doctors and take an opinion.
Absolutely.
Yeah. So, sir, as Dr. Anand was explaining to us, there are two types of stroke. One is bleeding stroke, and one is the clot type stroke. Okay. So both have their own side effects on the body after the attack. What is the medical management and what is the surgical management of these types of strokes?
So, uh, when there is bleeding in the brain, the bleeding type of stroke is much less common. It's about 20% of all strokes. 80% are accounted by clots.
Okay.
These clots normally arise either from the heart or from the large blood vessels in the neck. So
Okay.
these are the broadly the two types of stroke.
Okay.
Since the clotting type of stroke is more common, I'll first talk about that. So
Okay.
there is a window of opportunity when the stroke happens, when the person has to recognize the signs of a stroke. And there is a very nice acronym for this called FAST. FAST
Yes.
is face. F stands for face. When there is some twisting of the face or little facial asymmetry, so one must take immediate notice of that. These are the early signs of stroke. A stands for arm. So suppose there is some numbness or weakness in one arm, that should be taken notice of. S stands for speech. Suppose there is
Okay.
slurring of speech, garbled speech, or the person is using inappropriate words all of a sudden, that should be
Yeah.
taken notice of. The last letter is T. So without wasting time, one must rush to a hospital. The window of
Okay.
opportunity is this first 4.5 hours after a stroke, because
Okay.
in this duration, medication can be prevented to actually dissolve the clot.
Okay. Okay.
And the outcome of a person having a stroke is much, much better when this medication is given in the small
In
subset
that
of patients.
window.
And so person can must rush to the hospital immediately on recognizing these symptoms, either in themselves or in their relatives.
Okay.
As far as the bleeding type of stroke goes, there are certain very clear indications for surgery, but even when there is blood in the brain, a vast majority of persons may not require surgery at the outset. It is only a small subset of patients who've got a bleeding type of stroke who require surgery.
Okay. 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 So, what is the recovery period with your experience, both of you? I mean, would you like to enlighten our viewers on the same? Because people obviously
The
get.
recovery period depends largely on the extent of the stroke. So some patients may have such a mild stroke that it recovers within minutes, and we call this a transient ischemic attack. So there is no permanent, long-lasting damage to the brain. And in fact, if you do an MRI, it may actually come out to be normal. So these
Okay.
persons will recover very quickly, but we should take them as warning signs of future stroke, and so they also must be evaluated carefully. On the other
Okay.
hand, if the patient has got a stroke which involves a certain part of the brain, that also the recovery period depends on the extent of the stroke. Some of them have got large amounts of brain which are involved at the outset itself, so they may take months or years to recover. Some of them they may take weeks to recover. So it's a very wide kind of a variation as far as the recovery period goes. But one must always be encouraging to the patient, because almost everyone recovers after a stroke. The maximum problem is at the outset, and gradually they recover. And even up to 2 years after the onset of a stroke, persons continue to improve. So, giving them hope is a very, very important thing, because post stroke depression is very common, and we must not contribute to it by being a little nihilistic about their outcome.
Yeah. So, talking about recovery post strokes, since after the medical management, I want to know the importance of rehabilitation post stroke from both of you.
I think that's a very, very important question. Rehabilitation is absolutely crucial, and it will not be like it is not only the neurologist who is involved here. We must
Yeah.
definitely involve a proper neuro rehabilitation team. There are very specific protocols on how to rehabilitate a person for stroke, both physically, mentally, socially, occupationally. So each of
Yes.
these aspects is important. So physically, that means they can do some range of motion exercises either on their own, or they may be assisted by a physiotherapist. In the initial stages, it has to start on day one after a stroke. That is very important. We must not delay the physical therapy for much longer. It should
Yeah.
start on the day that they have the stroke. So within
Okay.
the hospital, a physiotherapist can uh, be involved right from day one, and even after they go home,
Yeah.
person physiotherapist can visit the home, and of course with due assistance of family members. And
Yeah.
subsequently, when the patient is a little better, they must be encouraged to do exercises on their own as well. So this is
Okay.
as far as the physical rehabilitation goes. Many of
Okay.
these patients may have speech problems. So,
Yeah.
so a speech therapist can be involved, and that also helps a lot.
Yeah.
And once they're a little better, possibly when they start walking, so their rehabilitation should include occupational therapy. So
Okay.
many of these patients may not be able to go back to their original jobs immediately.
Okay.
So while they're in the process, they can be either retrained for other jobs as well. So whatever they can do, and over a period of time, if they're able to rejoin their original occupation, full support must be given both to the individual, to the organizations who are employing them. So it's a whole gamut of persons who are involved in all this. So stroke care is not the neurologist or the neurosurgeon alone. It involves a physical rehabilitation therapist, a speech therapist, a psychologist, a sociologist, a community member. So
Yeah.
all these members have to be involved for complete and comprehensive recovery.
Thank you, sir. Sir, Dr. Anand, what is your opinion on the same?
Yeah, Dr. Lieutenant Colonel Narayan, General, sorry, has nicely elucidated all the.
I think he's out of network. Jan Narayan, can you hear me?
Yeah, I can hear you.
So, sir, you have actually quoted it very beautifully. Yes, sir. Dr. Anand, please continue.
Yeah, yeah. So just a few points I wanted to stress here that he mentioned the window of 4.5 hours. So that window is very, very important. That is because you can prevent the stroke from happening. Whatever
Yeah.
stroke has happened, if you can get that in that golden hour period. So with the modern treatment that are available, which is normally called as thrombolysis, a patient can walk back the same day probably without the effects of the stroke that has happened. The blood
Okay.
clot just dissolves in the blood pipe, and patient may not have the deficit with which he actually presented to the hospital, the fast which Narayan sir had mentioned. So that golden hour is very important. People have to understand that if they develop anything in the face, arm, or speech, they have to reach within 4.5 hours to the nearest facility where they can be treated and escape from a paralytic attack of stroke. Very, very critical. Nowadays, the window is even increasing. If it is a
Okay.
major thrombus, major block, people can even do intervention like they do for the heart. They do primary angioplasty, they put a stent. Nowadays, doctors are equipped to remove the clot from the
Yeah.
blood pipe by
Okay.
just putting a wire through from your leg and removing the clot completely, and patient's blood flow to the brain is re-established immediately. All this requires a team effort. You should know which hospital, where to go, where it is being done. The awareness is very critical. Early
Yes.
diagnosis is very critical. So the awareness for early diagnosis and immediate attention to go to a hospital where these facilities are available, you can prevent a stroke from establishing itself completely. But once it is established, then the
Yeah.
treatment becomes twofold. One,
Yeah.
preventing it from increasing further
Yeah.
with medication so that the stroke doesn't propagate. And second, life threat. There should not be a threat to life. So that's where we as surgeons come in. Sometimes large part of the brain gets attacked, stroked. So they tend to swell up and then they can cause damage to life by the pressure building inside the head. So we can prevent that by removing the bone, giving space for the brain. So this again requires a multi-speciality treatment center where a stroke unit is in place, where the neurologist, neurointerventionist, radiologist, neurosurgeon, all of them work together for the purpose of the patient. If that window is also crossed, the life threat is crossed, and the surgery was required or not required, as Narayan sir said, the initiation of rehab care from day one is very important. Most
Thank
people
you, sir.
think stroke treatment is over, discharged, and go home and just keep lying down. They're not going to improve. Most strokes can walk. However severe stroke one has, if you rehabilitate them well, they will bring back their large joint movements. At least they'll be independently mobile. If you don't
Yeah.
treat them well, they may be lying down, develop bed sore, pneumonia, some infection, and they will be either fatal outcome or no improvement at all. So
Yes.
the need for rehab, starting early physiotherapy is very important. And
Yes.
seriously, no point doing after 3 months when nothing has improved. Nothing has improved. Now taking to rehab, you won't get so much of improvement. You have to do it at the early part, immediate part, from day one, from day zero, that rehab starts. So all these members, the entire group, neurology, neurosurgery, intervention, neuroradiology, neuro rehab, are the
Yes.
pillars of care for stroke, for prevention, for stopping stroke from becoming severe, for saving life of a stroke patient, limiting damage, and for rehab care to put them back to socially useful life.
Thank you, sir. Thank you, sir. Sir, so as a clinical rehab specialist myself, I understand from both of you that there is a high need of hospitals to be equipped with a good neuro rehabilitation setup. Basically, if you all agree with me, then the setups in hospitals are basic, and they can only provide basic physiotherapy. But from you both, I understand that there is a high need and importance of having a complete neuro rehab setup with experts who have been treating neuro cases, and who have been trained as neuro rehabilitation experts for treating such kind of patients. It's not about just the basic physiotherapy.
Absolutely. So it's a very important thing. Like all of us agree, it has to be done by a specialized team which has been experienced in giving care to stroke patients. So
Yeah.
stroke rehabilitation is quite different from general rehabilitation, or like you very correctly said, the broad term that everyone uses, physiotherapy. There's so much
Yes.
more to it, and so they're very very competent specialists. And just
Yes.
to elaborate on what Dr. Anand said, it is also very important because of the things that he said, that the patient reaches the right kind of facility at the right time. Suppose they identify that they have, or their family member has a stroke in that window period, and happen to go to a very small hospital which is nearby, which is not equipped to treat stroke. So they will lose very important time. And why we say 4.5 hours, it is also important to know that every minute that is delayed, around 1.9 million brain cells die. So
Okay.
though we say 4.5 hours, it is earlier the better. So that concept also has to be ingrained in everyone. So a person who comes within half an hour has got a much better chance of recovering than a person who comes after 4 hours. So this, it is not 4.5 hours as a rigid timeline. Earlier the better. So that is important, and reaching the right facility is very important, because
Yes.
suppose go to a facility without facilities to give that clot busting medicine, they lose time, and or they may go to a facility where they can be given the clot busting medicine, but they cannot be offered this clot retrieval, like mechanical thrombectomy we call it. So it's always good to go and be aware of a center which has got all the facilities that Dr. Anand so correctly said. The neurologist should be available, neurosurgeon should be there, neuroradiologist, neurointerventionist, and the rehab specialist. So, going to the right facility is crucial.
Yes. Dr.
The
Anand,
other aspect,
yeah.
yeah, on neuro rehab,
Yeah.
the concept of a physiatrist. Most of
Yes.
the rehab centers, in fact, in most hospitals, they are very happy to have a dynamic physiotherapist who cannot probably see the patient as a whole, as a
Yeah.
physiatrist would, and give a line of care or treatment which progressively increases the interventions needed. So either
Yes.
you need a good physiotherapist who's trained in neuro rehab, or you need a good physiatrist who can overarchingly take care of the patient post stroke. The
Yes.
physiatry is available freely nowadays in most hospitals. The training also is there, MD physiatry. But
Yes.
it's so sad that even physicians, surgeons are not even aware that such physiatrists exist. And getting, yeah, so you need to have a team, a good team of neuro rehab, which is led by a good dynamic person who can assess the patient's needs and keep putting on one after the other. More often, I see patients go home, they get good home based care. One physiotherapist comes home, they just do range of motion activities and go away.
Yes.
Patient is not going to walk, patient is not going to stand, patient is not going to sit or move himself. No transnational exercises, no self activating exercises, no cashing in on any joints which are recovering, nothing
Yes.
happens. So we are very good in the conceptual understanding of physiotherapy, but when it comes to practical
I
I think
think
we
this.
lost Dr. Anand.
Yes, yes. So he was so rightly, he was, as he was mentioning that, physiotherapist goes home and treats the patient. I think that is just an hour's job that they do. The rest 23 hours, the patient is not doing anything. So the recovery in such cases would be absolutely poor. The patient has to be involved for the complete day in some or the other activities for their recovery. Just an hour of physiotherapy, a basic physiotherapy, will not help a patient who has suffered such a deadly disease.
So, like some audience member said, these days with a lot of AI and robotics coming in, I think that is one area where there are a lot of advancements which have been made in physical rehabilitation. And whoever posted that message is absolutely correct. So, there are very specialized centers which take advantage of robotics, virtual reality, and
Yes.
of course, they're not available everywhere. But if the patient has got access to them, the chance of recovery are much brighter, of course.
Great, sir. Sir, we have some questions from the viewers. Just a minute, sir. I'll check for them. Sir, one of the viewers have asked, what subtle or non-classic stroke symptoms are most commonly overlooked?
One of the things, like we told you about this acronym called FAST, right? So that addresses the facial weakness, it addresses the arm weakness, the numbness, it talks about
Yeah.
speech. So these are pretty easy to identify. But it is also two more additional letters have been added to it now. So it is called B FAST. So B stands for balance problems and
Okay.
eye stands for eye problems. So they can have vision problems, which could be very subtle. They can have double vision or visual impairment and a little unsteadiness of gait and all that. So they may just write it off as just being some another kind of giddiness or being wobbly.
Yes.
So these kind of eye problems and balance problems are even more common in strokes which involve the back of the brain, what we call posterior circulation strokes. And these are quite subtle, and these are the things which can be missed easily.
Okay. Dr. Anand, your take on that?
in these are acute strokes. So some people who have, say, chronic diseases like diabetes, hypertension, they can have chronic strokes like chronic ischemia, small vessel diseases which keep causing small areas of infarct in those parts of the brain which are not easily evident immediately, like in the BFAST criteria. So these strokes can be picked up only when you do a scan. When you suspect somebody is having some problem, you do a scan, you find these small ischemias, and then you start putting them on blood thinners so that they don't develop a major stroke. They don't develop further strokes like these. So if you have any risk factors for stroke, it is good to meet a specialist and check yourself periodically to make sure that you are not getting into these silent strokes, which may keep increasing over a period of time and may eat into your cognition or your other features, which may be diagnosed much later after they happen.
Great, sir.
Yeah,
Sir,
to
we
add to
have.
what Dr. Anand said,
Yes.
let me add a couple of points. One
Yeah.
is he very correctly said that strokes can be either acute or chronic. So
Yeah.
chronic things can also present with memory problems,
Ah.
which almost mimic conditions like Alzheimer disease. And
Yeah.
there's another condition which is very, very important in the elderly and which I had alluded to earlier as well. If a
Yeah.
person has got a headache, we talked a little bit of a headache as well, but a
Yeah.
person who has headache could be having this condition called subdural hematoma. And
Oh.
these patients can also be present with some quirks of behavior or some mood changes and things like that. And the subdural hematoma is a kind of stroke which is eminently treatable. They have to be operated, of course, a vast majority of them, but the operation is very simple to do and the recovery is dramatic.
Thank you so much, sir, for those insight. So we have a viewer who has just joined from Kurdistan of Iraq, Mr. Zana. So he has a question. Do you think stroke can be genetic disease just like diabetes that you may get it from your parents?
Dr. Anand, okay, so stroke
Yeah,
in a vast majority of patients has got some predisposing factors, and genetics has to do a lot to do with almost all the predisposing factors.
Yeah.
So genetics does play a role, but it is not likely that a person whose parents have got a stroke, the child will also have a stroke. It's not one-to-one transmission like that. But
Okay.
the overall risk profile, so it is more appropriate to say it is familial rather than genetic, though there are some causes which are very rare, which involve single genes as well, which can cause a stroke. But the vast majority of strokes, I would say, familial and not genetic.
Okay. Dr.
that's
Anand?
correct. So the risk factors for stroke that can be genetic, but not the effect of stroke itself. If you can handle those risk factors correctly, if you can control your diabetes, you're prone for diabetes. If you are uncontrolled diabetes, then you're prone for stroke. You are genetically susceptible to have hypertension if your parents had hypertension. But if you don't control the hypertension well, then you may land up a stroke whether your father or mother had one or not. So you
Okay.
have to control the risk factors for stroke rather than worry about stroke being genetically transmitted. At least you can modify the risk factors. That is in your hands. That is definitely environmental influence, personal influence, health, lifestyle
Yeah.
influence, medication, good discipline control can reduce the risk for stroke even in genetically susceptible high risk individuals.
Thank you, sir. Sir, we have another question. So, if a hypertensive patient is on a calcium channel blocker, do these medications offer any stroke preventive benefits? And what long-term effects are associated with their chronic use? Can you hear me, sir?
Yeah, just now, I think
Yeah,
there
I
is
can
some
hear you.
connection issue in between.
Yeah, there was some
Yeah, in
connection
between
issue.
we lost your voice.
Yeah.
You can
So,
ask the
sir,
question again.
one of the viewers has asked if a hypertensive patient is already on a calcium channel blocker, do these medications offer any stroke preventive benefits? And what long-term adverse effects are associated with their chronic use?
Okay, I don't think Dr. Anand is available. So, calcium channel blockers are one type of antihypertensive medicine. Actually, it is not
Okay.
dependent. It depends purely on the type of medications that are prescribed by the person who's treating the blood pressure. So, it is not that calcium channel blockers offer any special advantage over the other antihypertensives. So,
Okay.
the more important thing is for your blood pressure to be under control, and your physician will choose the appropriate medicine required for you. So
Okay.
I don't think calcium channel blockers offer any special benefit over other medications. Having said that, we have talked about dissolving the clot. We have talked about removing the clot. There are some neuroprotective strategies as well. So there are some medications being tested now to protect the brain from the effects of a stroke. In that respect, there are some calcium channel blockers which are not routinely used for blood pressure management, but those kind of calcium channel blockers have been tried. But unfortunately, none of the neuroprotective strategies are effective enough for us to be recommending it to a large population at the present point of time.
Okay. Okay. Dr. Anand,
There is
your
no
opinion?
easy pill that can be, yeah, there is no easy pill that can be swallowed that can protect you from stroke.
So one of our viewers has one another question. So, does if statins are started post stroke, Does it prevent any chance of having another stroke?
Dr. Anand there. I can't hear him, so I will answer it again. Uh, uh, so statins are used particularly in the stroke is basically a blood vessel problem. One must
Yeah.
understand that. And
Yes,
the
yes.
blood vessel problem is same as the heart for the stroke. Actually, so that is why the heart and the brain are very closely connected. And the most important culprit is all these diseases that happen in the blood vessels,
Yeah.
primarily because of accumulation of cholesterol and they become plaques and things like that. And
Yeah.
to prevent the chance of these plaques, that means obstructions that are happening, these blood vessels are happening, statins are used. In the initial stages, a higher dose of statins can be used up to sometimes 80 milligrams of the commonly used drug atorvastatin, but subsequently a
Okay.
smaller dose may also suffice. So they
Okay.
definitely have a role in the secondary prevention of stroke, as we call it. Secondary prevention means a person has had a stroke and you're trying to give medication so that a second stroke is prevented. So,
Okay.
decreasing the cholesterol levels and also remodeling the blood vessels where these clots form. So, the
Yeah.
statins have got two uses. One is to prevent, lower the lipid levels and also to remodel the blood vessels. And both of them go a long way in preventing further strokes.
Okay. 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 Thank you so much, sir. Sir, we have got a lot of very, very, very insightful information for our viewers from you both regarding the type of stroke, the medical management, the surgical management, the importance of rehabilitation, the importance of having a neuro rehab setup, especially in hospitals post stroke, so that the patients can benefit from them. So I would like to have a closing note from Dr. Anand and General Narayanan, both of you, for our viewers on the same.
I can't see Dr. Anand, but
I,
if he's there, I'll give him the first shot.
Dr. Anand, can you hear us? Sir, in the meanwhile, you can start, sir. I think there's an internet issues there.
Yeah, yeah.
Yeah.
No, no, it's been a fascinating session. I think it's always so useful discussing a very important topic like a stroke, which happens. Actually, it's been estimated that one fourth of the population has got a chance of lifetime risk of having a stroke. So,
Yeah.
one in four persons will have a stroke once in their lifetime. So, it's such an important topic, and we
That's a big
happen to be
number, sir. One
discussing
in four is a big number.
and we happen to be discussing it on a very important day, that
Yeah.
is the World Stroke Day, where you're trying to spread awareness of stroke to a very large audience. And I think this has been very interactive with so much of audience participation. And
Yes.
we can go on and on. It's such an important topic, but
Yes.
in the constraint of time, we'll have to close it here. But I would like to thank Dr. Vijita for hosting the session so elegantly and for all the audience who participated with so much enthusiasm. A big thank you to all of you.
Thank you so much,
And
sir.
let us make sure that we have learned a few messages from our conversation, and
Yes.
we at least take care of ourselves in future so that we minimize the possibility both in ourselves and in our close family members to have a stroke.
Thank you so much, sir. Dr. Anand, can you hear us? I think there's a major internet disturbance. So to conclude, uh, our viewers, we have this insightful information from both the doctors, and stroke is something that is preventable. But yes, if you suffer stroke, we have we have a panel of expert doctors who can help us recover stroke, and of course neuro rehabilitation post stroke will help you recover completely and get back to functional independence post stroke. I think Dr. Anand is also here. We would like to have a closing note from your end, sir.
Thank you. Thank you so much. much for organizing this. I think most important is the awareness. I think creating awareness on this World Stroke Day was very essential, and you have done it very well. And hope we are able to carry this forward and create more awareness among the individuals to reduce the risk and the aftermath of stroke. Thank you so much.
Thank you so much. Thank you,
Thank,
Dr. Rajan. Thank you, Dr. Narayanan.
thank you. All the best. Take care. And all the best to the audience as well.
Thank you so much. Bye bye.
Thank you.